Hello, hi everyone. A warm good evening to everyone. I hope you all are doing good. So, I'm back with another live session, and today we will be looking into the speaking module. And as you guys can see, the topic that we are going to discuss today is how effectively you can utilize your 3 minutes preparation time to develop conversation for about 5 minutes. So as the poster was shown to you guys, it is 3 minutes equals to 5 minutes. So I got a lot of questions from a lot of people about how we can use it. And most of the time when I come live or do Zoom webinars or take the big bonus classes for the students, the common question I get is how to utilize the 3 minutes preparation time. And I get a lot of questions like what to do during the 3 minutes preparation time. And the main thing is they ask me, is it possible for someone to finish reading everything in 3 minutes and prepare for a 5 minute conversation? So in today's live, we will be discussing all those questions. And towards the end of this live, I will show you a cue card, and then I'll show you how you can prepare that cue card within the 3 minutes based on the class that we'll be taking. Okay, so make sure that you watch till the end, as well as if you guys have any questions, feel free to ask me that too. So let's see. All right, so I hope you guys are having a good preparation, and if you guys would like to get any particular topic, any live or any Zoom on any particular topic, feel free to comment or message to us, and we will be more than happy to do that for you guys. So let's see. Let's wait for some more people to join. Okay, please do comment where you're from, where is your place, so that I can decide on the language that I need to stick on to the most. Jyoti, hi, good evening, Jyoti. Hello there. Rija, hi, Rija. So, do let me know how you guys utilize your 3 minutes preparation time. So then if I know how you are doing it, and if I feel like then we need an improvisation there, then I can share more points on that particular aspect. So let me know how you do it, okay? Because we all, I hope most of us who's watching this live will be, will have already done many cue cards, and they might have utilized the 3 minutes as well. So tell me, what do you guys do during the 3 minutes preparation time? And also tell me whether you're happy with your strategy, whether you're able to cover all the points within the 3 minutes, whether your preparation is so effective that your role play went well. Do let me know that. Dahlia, good evening. Hi. Neetu Achish, good evening. Hello there. Anna, hi Anna. Feel free to comment your questions, your queries, as well as feel free to discuss, because this is a platform where you can raise your questions for about 1 hour starting from now, and I will be free to answer all those questions as well if I know the answers. So yes, you guys please do ask me the queries, and if you guys can let me know how you prepare for the 3 minutes preparation time. Based on that, I can start with the session and discuss more points, because I have formulated almost 10 points or 10 tips that you can do during the 3 minutes preparation time to effectively prepare for the 5 minutes, as well as towards the end I'll show you a cue card, and we will together discuss it, how we can utilize the 3 minutes and frame the points and the sentences and all the questions and everything, okay, everything, and we will learn it together. So Anna is from Saudi. All right. So if you guys could let me know how we prepare it. So normally what people do during the 3 minutes preparation time is that most of the time, of the 3 minutes, most of it will be spent for reading everything, and then they will be just looking onto each task, and they won't be effectively using it or making any notes and things like that. So after this live session, I am very sure that you guys will have a clear idea about what you need to do during the 3 minutes preparation time. So let's get started, and meanwhile, if you have any questions, please raise it, and towards the end of the session as well, we will discuss that together. So we all know that for the examination, we'll have 2 role plays of 5 minutes each, and you will get 3 minutes preparation time for both these role plays too, each of these role plays. So during this 3 minutes, other than preparing what you need to talk for the 5 minutes, you can even raise questions if you have any concern, any doubts, or if you're not clear about any particular topic that is being mentioned in the case note, you are free to ask that question to the interlocutor during that time. Also, you can ask the name that you need to address the patient in the role play, and I highly recommend that as well. So if it is a non-case and if you feel like you need the name of the patient for the conversation, then you can do that too. So this interaction can also happen in this 3 minutes time. That is when you have any doubt, or when you have any question that you need to be, even that you need to raise to the interlocutor. Keeping that aside, there are a lot of other things that you need to keep in mind while you are utilizing your 3 minutes preparation time, because I would personally say this 3 minutes is what determines your 5 minutes performance. Because if you prepared really well, if you jotted the points really beautifully, and if you have a clear idea about what you're going to talk, your 5 minutes is going to be brilliant. So everything lies in how we prepared for this 3 minutes. So let's see how we can effectively do that. The first 3, okay, so before that, I can see some people commenting about the 3 minutes. Okay, Rita said in 3 minutes, what I'm doing is finding out the healthcare settings. Good. Who am I? To whom I'm speaking? Good. The reason behind the talk, and finally providing with a solution. I won't get much points in that time. Kindly suggest me how to improve. Definitely, that's what we are going to do here. Marinello is saying, identify the setting. Yes, non-case or non-case, plan and organize, mark keywords. That's right. So you guys have kind of like an idea about what you would be doing. So I would like to add many points to help you to improvise your preparation time. So as few of you suggested, the first thing that you have to do when you get a case note or when your preparation time starts is that you need to identify the setting. The importance of the setting is that is when you know where the conversation is taking place. So you will also know who you are, what is your role. Okay, so you really need to understand where the conversation is taking place, because based on that you can you can select the perfect, the suitable language or the suitable attitude that you need to bring up with. Okay, so setting is the first thing that you have to note, and many people come to a conclusion whether it is a non-case or a non-case just by reading the setting. Never do that, okay? Just by looking at the setting, you cannot come to a conclusion whether the setting that you're dealing with is a non-case or a non-case. For that, you need to read through the background information and get to know whether any particular examination was done, or whether the patient was already consulted, already checked by someone else, maybe a triage nurse, or the patient has come back for a review. So all this information will be mentioned in the background details. So you really need to go through that before you come to a conclusion about whether it is a non-case or a non-case. So the first thing, as I mentioned, that you need to know is your setting. So the second thing, read through the scenario, the background information, to get a clear idea about where exactly this is happening. Okay, when you read the background information, you will get to know who you are, okay, to whom you're talking to the patient or the bystander, what is what is your duty or responsibility, or what the patient is expecting from you. So you will get to know all the scenario there. So after reading the setting and then reading the background information, you will get to know how you have to start. Okay, like your opening statement. All right, so the next thing that you have to do is you have to frame your introduction then and there itself. The reason why I'm telling you is that because Many people go wrong with the introduction. If you go wrong with your introduction, it is going to affect your confidence in a very, very bad way. You will feel like, oh, I made a mistake initially itself, it's going to affect my score. So it will affect your following conversation as well. So in order to avoid that, it is, I highly recommend you to read the setting and then go through the background information and then frame your introduction then and there itself. Keep a practice of it. Whenever you're preparing for the 3 minutes while you do the preparation with your friends or your tutor, make sure that you prepare the introduction at that time itself. I have seen many people, they are thinking of an introduction while they start the role play. They are not very clear about how they are going to start. When you have a good kickoff, your entire journey will be smooth. Otherwise, you'll think like, okay, I made a mistake there and everything is going to be a mess. So it will be very much reflected in your tone as well. Your confidence will go down and your voice modulation will be affected as well. So in order to avoid that, make sure that you prepare your introduction after reading the setting and the background information. Now, if you ask me, will you be able to do that within the 3 minutes? Yes, absolutely. You have to train yourself to do that. If you have a proper training of quick reading and quick understanding, then it is going to be easy. Initially, it might be a little difficult, but trust me, it is going to be very easy. And when you go for the exam also, you will be automatically doing it because you have been doing this for some time now and you're trained on that. So when you are attending the exam also, your brain will be processing really fast so that you do not have to worry about what comes next because you'll have a clear idea about it. So that's the first thing, understand the setting. The second thing, understand the scenario, okay? And the third thing, you have to prepare your introduction. Okay, so now we have finished this setting part. Then we have read the background information and we have decided our introduction as well, how we are going to open the conversation, okay? Then what next? The fourth thing you have to do is you have to read through the tasks. Okay, you might have 4 tasks or 5 or 6. So you need to make sure that you read through the tasks real quick and try to get a general information about what is being discussed there. You can definitely do that. If you ask me whether I'll be able to finish everything within that short time, you can. Because you guys are people who deal with long paragraphs and short tests from the reading, and you finish it, you spend only 30 seconds or 2 minutes for a question. So if you guys can do that, a cue card will be of hardly 180 to 200 words, not even that much. It will be between 100 to 150 words. So you guys can read everything as well as you guys can get to understand the meaning as well. In case if you don't understand the meaning of a particular task, do not panic there, okay? You will come back to that task again when you're preparing notes for it. This point, what you have to do is, after preparing the introduction, have a quick go through the tasks. Just familiarize yourself with what are the tasks that you need to attend to. So that is the fourth thing that you have to do. So just a recap, the first thing is understand the setting, then you have to read through the background information to know what exactly is happening there, and then you have to frame your introduction. The fourth thing is you have to read through the tasks real quick, okay? Make it an expeditious task. You have to grasp as many information as possible in a real quick read, okay? So that is the fourth point. Moving on to the next thing, what you have to do. You have to try to understand the requirement of the patient or the bystander. Once you read the tasks, you'll get some information. Maybe not the complete information, but still you will get to know few details about how the patient's behavior is, whether it is an educational cue card or whether the patient is reluctant or agitated or if they're nice patient. So you'll get to know some information. Also, you will get to know some information that you need to provide to the patient as well. But what you need to try to understand there is that you need to know what is the requirement of the patient. By reading the task, you will get to understand a glimpse of the requirement of the patient by seeing the task itself. Say for example, if you see when the patient is reluctant, you can understand that the patient requires reassurance there. Okay, or if you see that console the patient, you can understand that the patient requires empathy or emotional support there. So you will get to know what is the requirement of the patient, and I'll tell you why it is important. It is very important when it comes to your OET role plays, because only when you know what is the requirement of the other person, you will be able to provide accurate and appropriate solutions for that. And once you give accurate solutions, you'll get a good score because you met the expectations of the patient, relation with the patient will be good, you understood the patient's perspective, you gave all the good information, you maintained a good structure, so you will get a good score there. So it is very important that you know the requirement of the patient or the bystander that you are talking to. And how to know that? While you're reading the task, you will come across certain words like reluctant, console, okay, upset, something like that. So once you get to know such words, you'll understand, okay, if the patient is reluctant or agitated, that means I need to convince the patient more by using a lot of reassurance statements. Or if you come across terms like console or tactfully explain, that means that you need to be a little more emotionally and empathetic to the patient. So that's how you try to understand the requirement. Okay, so that was the fifth thing. Moving on to the sixth thing. The next thing that you have to do is you have to prepare the initial conversation. The initial conversation, I hope most of you guys, you guys know it. The reason being because initial conversation is something that comes after the introduction. You introduce yourself to the patient, and then the patient explains the concern. As an answer to that concern, you will be providing an initial assurance, right? You need to prepare that also in your 3 minutes preparation time. It is a very simple statement. It's not a very huge one. You just need to try to understand which which initial assurance you are going to use. If it is a non-case, you can use I'm sorry to hear that, but don't worry, you are in safe hands. Okay, something like that. Or if it is an unknown case, you can say, oh, I'm sorry to hear that, but don't worry, you have reached the right place. We will do the needful. So you can pre-plan it. You can learn it even before the exam during your preparation time. And when it comes to the exam, and after understanding the entire scenario and the requirement of the patient, you can decide, okay, yes, this is what the patient needs to hear from me, so this is my initial assurance. So once you decide that as well, you will have a good opening statement. You also made the patient comfortable to talk or give more information by giving a good initial assurance. And initial assurance will definitely improve your score because that shows a very beautiful flow of a conversation, and that is going to be a better interaction as well. Okay, so that is the sixth thing that you have to do. Now, what next? So till this part, make sure that you guys try to do it within 1.5 minutes or something like that, okay, because it is very easy. You can finish reading everything maybe within 1 minute or so, the entire cue card, the setting, the introductory part, the background information, then the tasks and everything. It will only require about 1 minute or so because it's a short phrase, right? Short paragraph. After that, you'll have 30 seconds more. So in that 30 seconds, you have to frame your introduction, your initial conversation. Okay, so 30 seconds is more than enough for that. I would say if possible, try to bring it down or shorten it maybe to a 10 or 20 seconds because it's just, if you're pre-planned, okay, if you know like, okay, if this is my situation, this is how I'm going to have my opening statement. If you know that beforehand, then you do not have to spend a long time thinking about how do I need to start, right? So pre-plan it, know the situations before, okay, ഇതുപോലൊരു സിറ്റുവേഷനാണ് വരുന്നതെങ്കിൽ ഞാൻ ഇങ്ങനെയാണ് ഇൻട്രൊഡ്യൂസ് ചെയ്യാൻ പോകുന്നത് എന്നാൽ നേരത്തെ പ്ലാൻഡ് ആണെങ്കിൽ നമുക്ക് ആ ഒരു പ്രിപ്പറേഷൻ്റെ സമയത്ത് നമുക്ക് ഒത്തിരി നേരം ഒന്നിനും സ്പെൻഡ് ചെയ്യേണ്ട ആവശ്യമില്ല. വൺസ് യു അണ്ടർസ്റ്റാൻഡ് ദ സെറ്റിംഗ് ആൻഡ് വൺസ് യു അണ്ടർസ്റ്റാൻഡ് ദ എൻറ്റയർ സിനാരിയോ യു വിൽ നോ ഓക്കെ നൗ ദിസ് ഇൻട്രൊഡക്ഷൻ സോ ഇറ്റ് ഈസ് ഡൺ. It is clear for you, okay, you are not confused there. Then if you know that okay, this is a known case and it is an unknown case, then you know your initial assurance as well. ഇതൊക്കെ pre-plan ചെയ്ത് വെക്കുക. Pre-plan means ഇപ്പോൾ പഠിക്കുന്ന സമയത്ത് തന്നെ preparation നടന്നുകൊണ്ടിരിക്കുന്ന അല്ലെങ്കിൽ കോച്ചിങ്ങിൻ്റെ ടൈമിൽ തന്നെ you have to teach yourself, okay, these are the things that I need to speak if this is the situation. അങ്ങനെ prepared ആണെങ്കിൽ you do not have to waste your time thinking of what you need to talk or how you need to open your statement or what initial assurance you have to provide. provide. You can save time and you can utilize the rest of the minutes to formulate the sentences and the entire flow of the conversation. Okay, so അപ്പോൾ ഇത്രയും കാര്യങ്ങൾ നമ്മളൊരു 1.5 മിനിറ്റിൽ, ഓക്കെ 1.5 മിനിറ്റ് ഇത്തിരി കൂടുതലാണ്, ബട്ട് സ്റ്റിൽ ഒരു 1 minute 25 ഒരു 20 സെക്കൻഡ്സിലെങ്കിലും അത് ഫിനിഷ് ചെയ്യാൻ നോക്കുക. ഓക്കെ, സോ ദാറ്റ് യു ഹാവ് ലിറ്റിൽ മോർ ടൈം ദെയർ. ഓക്കെ, ദെൻ after this you have 1.5 minutes more. At that time what you have to do, so that's what we are going to discuss, and this is the most exciting part, because ഈ ഒരു ഏരിയയിലാണ് നമ്മൾ എങ്ങനെയാണ് ഈ കോൺവെർസേഷൻ ചെയ്യാൻ പോകുന്നത്, എന്തൊക്കെ പോയിന്റ്സ് ആണ് നമ്മൾ എക്സ്പ്ലെയിൻ ചെയ്യാൻ പോകുന്നത്, അങ്ങനെ നമ്മുടെ എൻറ്റയർ റോൾ പ്ലേയുടെ ഒരു ഗതി തന്നെ ഡിസൈഡ് ചെയ്യുന്നത് ഈ ഒരു ബാക്കിയുള്ളൊരു 1.5 മിനിറ്റാണ്. So അതിൽ what you have to do is, നമ്മൾ ഓൾറെഡി ടാസ്കുകളെല്ലാം വായിച്ചതാണ്. So the next thing is, go to each task. Okay, start from the first task. Then you have to identify the action words. ഓരോ ടാസ്കിലെയും ആക്ഷൻ വേർഡ്സ് ഐഡൻറ്റിഫൈ ചെയ്യാം. Now what are action words? Action words are nothing but those are the things that you have to do in that particular task. Say for example, the first one, address the concern. So what is action word there? Address. So what is your responsibility there? You have to address the concerns of the patient. You have to ask the patient what is wrong with him, or why he came to the hospital, or what you can do for the patient, or how the patient is feeling. So ഈ കാര്യങ്ങളൊക്കെ ചോദിച്ച് മനസ്സിലാക്കേണ്ടത് നമ്മുടെ ഒരു ഡ്യൂട്ടിയാണ്. ദാറ്റ് ഇസ് വാട്ട് ദ ടാസ്ക് ഇസ് ഫോർ. സോ അതുപോലെ ഓരോ ടാസ്കിലെയും ഓപ്പണിംഗ് സ്റ്റേറ്റ്മെൻറ്റ്, അതായത് ആക്ഷൻ വേർഡ് ഫൈൻഡ് ഔട്ട് ചെയ്യാം. Based on the action word, prepare an opening statement for it. Okay, ഇതും നമുക്ക് നേരത്തെ പ്രീ പ്ലാൻ ചെയ്യാവുന്ന ഒരു കാര്യമാണ്. If you guys know the common action words that are being asked or that are being seen or spotted in different cue cards, you can make a list. Explain എന്നാണ് എൻ്റെ ആക്ഷൻ വേർഡ് എങ്കിൽ, this is how I'm going to start my conversation. ഇനി പെർസ്വേഡ് എന്നാണെങ്കിൽ, ദിസ് ഈസ് ഹൗ ഐ എം ഗോയിങ് ടു ഓപ്പൺ. ഓക്കെ, കൺസോൾ ആണെങ്കിൽ ഐ വിൽ യൂസ് ദീസ് അക്നോളജ്മെൻറ്റ് സ്റ്റേറ്റ്മെൻറ്റ്സ്. സോ ഇതുപോലെ നമ്മൾ പ്രീ പ്ലാൻഡ് ആണെങ്കിൽ ഈ പ്രിപ്പറേഷൻ ടൈമും നമുക്ക് സേവ് ചെയ്യാം. സോ വെൻ യു സീ എക്സ്പ്ലെയിൻ, ദെൻ യു വിൽ സഡൻലി തിങ്ക്, ഓക്കെ ഇറ്റ്സ് എക്സ്പ്ലെയിൻ, സോ ഐ ക്യാൻ സേ ദിസ്. Okay, make notes. You will be given a paper, additional paper to make notes. Okay, so make utilization of that. Put number 1. Okay, write number 1, then write short forms. You do not have to write the entire wordings there. You can just write short forms. You can create your own language if you want to as well. Okay, because you are reading, so only you need to understand what is being written there. So based on that, you can have a proper start for each and every task. അങ്ങനെ നമുക്ക് 5 ടാസ്ക് ഉണ്ട്, അല്ലെങ്കിൽ 6 ടാസ്ക് ഉണ്ടെങ്കിൽ അതിൽ ആക്ഷൻ വേർഡ്സ് മനസ്സിലാക്കി ഈ ഓരോ ആക്ഷൻ വേർഡ്സിന് ഇങ്ങനെയാണ് സ്റ്റാർട്ട് ചെയ്യേണ്ടതെന്ന് കൂടെ നമ്മൾ പ്രിപ്പയർ ചെയ്ത് വെച്ചാൽ your entry to each task is smooth. It is very important, and trust me, you will see wonders in your cue card. Okay, next time onwards when you do your role play with your friends or with anyone, make sure that you try to implement this. Okay, you take a note, take a paper, put number 1 for the task number 1. See the action word. Okay, അത് എന്ത് ആക്ഷൻ വേർഡാണ് അതിന് ഒരു ഓപ്പണിംഗ് സ്റ്റേറ്റ്മെൻറ്റ് അവിടെ എഴുതി വയ്ക്കുക. ഓക്കെ, സേ ഫോർ എക്സാമ്പിൾ ഇഫ് ഇറ്റ് ഈസ് എക്സ്പ്ലെയിൻ, ദെൻ നോർമലി വി സേ ഐ വുഡ് ലൈക്ക് ടു എക്സ്പ്ലെയിൻ ദിസ് ടു യു. സോ ഐ വുഡ് ലൈക്ക് ടു എന്നുള്ളത് ഏറ്റവും ഷോർട്ടസ്റ്റ് ഫോമിൽ എങ്ങനെ എഴുതാൻ പറ്റുമോ ആ ഒരു രീതിയിൽ എഴുതി വയ്ക്കുക. The reason why I'm asking you to do that is because when you do the role play, when you have something written, when you have something handy like something to guide you, you will find it much more flexible to talk. Your brain will be more relaxed. You can concentrate more on the conversation, and you will feel light. You will not have all those the hectic feeling. You will not feel like, okay, what next, what I should do now. So ആ ഒരു ഹറി ബറി എല്ലാം നമുക്ക് അവോയ്ഡ് ചെയ്യാൻ പറ്റും. Okay, so understand your action words and plan it like that. So do it. ഇതുപോലെ ആക്ഷൻ വേർഡ്സ് അണ്ടർസ്റ്റാൻഡ് ചെയ്യാം. ദാറ്റ് ഈസ് ദ നെക്സ്റ്റ് തിങ് യു ഹാവ് ടു ഡു. What next? In 3 minutes preparation time, ഓരോ ടാസ്കിൻ്റെ എൻട്രി മാത്രം നമ്മൾ പഠിച്ചാൽ മീൻസ് പ്രിപ്പയർ ചെയ്ത് വെച്ചാൽ പോരാ. The next thing you have to do is the transition. Transition is nothing but how you move from one task to the next task. How can you do that? ഓരോ ടാസ്കിൽ നിന്ന് അടുത്ത ടാസ്കിലേക്ക് നമുക്ക് പോകാൻ ഒന്നെങ്കിൽ we can use connectors, Okay, if you're adding some information ഒരു നമ്മൾ ചെയ്ത് കഴിഞ്ഞ ടാസ്കിൻ്റെ കൂടെ ഒന്നുകൂടെ ആഡ് ചെയ്യുന്ന ഒരു ഇൻഫർമേഷനാണ് അടുത്ത ടാസ്ക് എങ്കിൽ യു ക്യാൻ യൂസ് മോർ ഓവർ ഇൻ അഡീഷൻ ടു ദാറ്റ് ബിസൈഡ്സ് ദിസ് ഐ വുഡ് ഓൾസോ ലൈക്ക് ടു എക്സ്പ്ലെയിൻ ദിസ് എന്നുള്ള രീതിയിലേക്ക് നമുക്ക് വേറെ ഒരു കണക്ടർ ഉപയോഗിച്ച് പോവാം. ഇനി അതല്ല അതിനെ കോൺട്രാഡിക്റ്റ് ചെയ്യുന്നതാണെങ്കിൽ നമുക്ക് ഹൗ എവർ നോ അല്ലെങ്കിൽ ദെയർഫോർ നോ അങ്ങനെയുള്ള എന്ത് രീതിയിലാണെങ്കിലും അവിടെ സ്യൂട്ടബിൾ ആയിട്ടുള്ള ഒരു കണക്ടർ യൂസ് ചെയ്തിട്ട് യു ക്യാൻ മൂവ് ഫ്രം വൺ ടാസ്ക് ടു അനദർ. വേറൊരു മെത്തേഡ് എന്ന് പറയുന്നത് അടുത്ത ടാസ്ക് ഏതാണ് എന്ന് മനസ്സിലാക്കി നമ്മൾ പേഷ്യൻറ്റിനോട് ഒരു ചോദ്യം അങ്ങോട്ട് ചോദിക്കുക. ഓക്കെ, സേ ഫോർ എക്സാമ്പിൾ task number 2 you explained about the diagnosis and the next task is where you're explaining about the treatment. Okay, it's a common example that I give because it is very easy to understand. So diagnosis കഴിഞ്ഞ് അടുത്തത് ട്രീറ്റ്മെൻറ്റ് ആകുമ്പോൾ ഒന്നെങ്കിലും നിങ്ങൾക്ക് ഡയഗ്നോസിസിൻ്റെ എക്സ്പ്ലനേഷൻ കഴിഞ്ഞ് കഴിയുമ്പോൾ moreover I would also like to discuss about the treatment options എന്ന് പറഞ്ഞ് മുന്നോട്ട് പോവാം. അതല്ല എന്നുണ്ടെങ്കിൽ if you want to interact with the patient you can ask a question. അവിടെ രണ്ട് type questions ചോദിക്കാം. The first type of question is, do you have any concerns? Okay, അല്ലെങ്കിൽ is there anything you would like to ask me about this condition? അങ്ങനെ എന്തെങ്കിലും ചോദിക്കാം, ഒരു general question. If not, you can ask a question about the next task. അടുത്ത ടാസ്ക് എന്താണ്, അതായത് ആസ് എ കാൻഡിഡേറ്റ് what you will be doing in next task, ആ ടാസ്കിൽ ആ എക്സ്പ്ലനേഷനെ ബേസ് ചെയ്തൊരു ക്വസ്റ്റ്യൻ നമുക്ക് ചോദിക്കാം. Now we know that the next task is about treatment, so you can ask, so Mr. David, do you know about the treatment options available? എന്നങ്ങോട്ട് ആ ഒരു particular question ചോദിക്കാം. Okay, you can lead the patient to that particular task. So Mr. David will say, oh yeah, the doctor mentioned something, but I would like to know more details about it. Can you please help me? So there you go. You will be like, yeah, definitely I'll help you with that, and you can get into the task explanation. That is how you do that. Okay, so also plan your task transition. It is very important because we need to have a clear idea about how you are going to move between your task, how you are going to interact in the task. So അപ്പം ജസ്റ്റ് നമ്മളൊരു എൻട്രി മാത്രം ഓരോ ടാസ്കിൻ്റെ ആക്ഷൻ വേർഡ്സ് വെച്ച് ഒരു എൻട്രി മാത്രം പഠിച്ച് അല്ലെങ്കിൽ പ്രിപ്പയർ ചെയ്തിട്ട് ഒരു കാര്യമില്ല. യു നീഡ് ടു ഓൾസോ നോ ഒരു ടാസ്ക് കഴിഞ്ഞ് അടുത്ത ടാസ്കിലേക്ക് എങ്ങനെ, ബിക്കോസ് ഐ ഹാവ് സീൻ മെനി പീപ്പിൾ ഗെറ്റിംഗ് സ്റ്റക്ക് ആൻഡ് they have no idea. They are so clueless about how to move from one task to the next task, and they have this hesitation, they have the stammering problems, and all those things will bring down your score one by one. So in order to avoid that, plan your movement. Okay, task 1 ഞാൻ ഇങ്ങനെ സ്റ്റാർട്ട് ചെയ്യുന്നു, and after that I'll explain the keyboard and then I'll finish it like this, and then I'll be moving to my task 2 like this. ആ task 2ലേക്ക് വരുന്ന ആ മൂവ്മെൻറ്റ് you need to be knowing it. കണക്ടർ ഉപയോഗിച്ചാണോ അല്ലെങ്കിൽ ക്വസ്റ്റ്യൻ ചോദിച്ചാണോ, അതുമല്ലെങ്കിൽ അക്നോളജ്മെൻറ്റ് സ്റ്റേറ്റ്മെൻറ്റ് പറഞ്ഞിട്ടാണോ. Sometimes you finish one task by asking a question to the patient and the patient will tell you a response. അപ്പോൾ ആ റെസ്പോൺസിന് ഒരു മറുപടി കൊടുത്തിട്ട്, അതായത് പേഷ്യൻ്റ് തന്ന റെസ്പോൺസിന് തിരിച്ചും ഒരു മറുപടി കൊടുത്തുകൊണ്ടാണ് നമ്മൾ അടുത്ത ടാസ്കിലേക്ക് പോകുന്നത്. ഇത് എല്ലാം യു ഹാവ് ടു ഹാവ് എ ക്ലിയർ ഐഡിയ അബൌട്ട് ഇറ്റ്. ഓക്കെ, ആൻഡ് ഇഫ് യു ആസ്ക് മീ ഇതൊക്കെ പോസിബിൾ ആണോ എന്ന് ചോദിച്ചിട്ടുണ്ടെങ്കിൽ യെസ്, ദീസ് ആർ ഓൾ പോസിബിൾ. ബിക്കോസ് ഇതിനൊന്നും ഒത്തിരി ചിന്തിക്കേണ്ട ആവശ്യമില്ല. യു ജസ്റ്റ് നീഡ് ടു ഡ്രോ ലൈൻസ് or you can just put arrows, and you can, on the worksheet you can just put arrows and you can write, okay, connector. So for a connector you can just use C/N, so you will come to know it, okay, it is connector. Okay, so adalla ഏത് connector ആണ് ഉപയോഗിക്കണമെന്ന് എഴുതണമെങ്കിൽ ഇപ്പോൾ however ആണെങ്കിൽ you can use HE. So you will come to know, okay, it is however. Okay, so create some short forms for you so that you can easily write it down and you know the entire direction of your conversation, so that while you're talking, when you go blank or when you feel like, okay, you're running out of ideas, you can just quickly look the worksheet and you can get information from that and you can speak based on it. Okay, so that is the next thing that you have to do. You have to plan the transition. Okay, here I would like to add one more point. If you guys come across wordings like when asked or when the patient arises the concern, when you see terms like this, make sure that you give a chance for the patient to ask that question. The reason being because when asked എന്ന് പറയുന്നത് ചോദിക്കുമ്പോൾ, അപ്പോൾ നമ്മളോട് ചോദിക്കണമെങ്കിൽ നമ്മൾ അവരെ കൊണ്ട് ചോദിപ്പിക്കണം. Okay, we have to give a chance. I've seen many people waiting for the interlocutor to do that. It's kind of like not the wise thing to do, because I'm not saying not all the interlocutors won't do it, but ചെയ്യുന്നവരുണ്ട്. ചില interlocutors will be very cooperative. They know that okay, next is my dialogue, so I have to start like this എന്ന് വിചാരിച്ച് ചെയ്യുന്നത് കോപ്പറേറ്റീവ് ആയിട്ടുള്ള interlocutors ഉണ്ട്. But most of them they don't do it. Okay, ഇപ്പോൾ നിങ്ങൾ ഓൾറെഡി എക്സാം ഒക്കെ എഴുതിയിട്ടുള്ള ആൾക്കാരാണെങ്കിൽ you guys know that you guys can get different type of interlocutors, right? So you might not, you cannot expect yes എൻ്റെ interlocutor എല്ലാം എന്നോട് ഇങ്ങോട്ട് ചോദിച്ചോളും. No. So if you see that okay, then your next task is when asked explain this, then when asked എന്നുള്ള പോർഷനിൽ പേഷ്യൻ്റ് നമ്മളോട് ചോദിക്കണം. So ask a question. Okay, is there anything you would like to ask me? Okay, or do you have anything else bothering you, or do you want to ask me anything else? അങ്ങനെ എന്തെങ്കിലുമൊക്കെ ചോദിക്കുക. So always not when asked, when the patient arises the concern, അല്ലെങ്കിൽ when the patient arises the question. ഈ രീതിയിലൊക്കെ ടേംസ് ഉണ്ടെങ്കിൽ wait for an interaction, okay? And that is the place where you have to interact too. All right, so that is something that you need to keep in mind. So that is the 8th point. We discussed a lot of points, so that is the 8th one, that we need to plan the transition, okay? After planning the transition, the next thing that you have to plan is when to interact. Now I just told you about the interaction. You need to know, okay, നമ്മൾ entire role play തുടക്കുന്ന അവസാനം വരെ നമ്മൾ തന്നെ ഓരോ ടാസ്ക് ചെയ്ത് പോയാൽ it is not going to help you to get a good score. If you need a good score, you need to interact with the patient, because this is a two-way communication, right? There is a speaker, there is a listener. And it's vice versa too. This listener will turn into a speaker, and that speaker will turn into a listener too. So അതൊരു two-way communication process ആയതുകൊണ്ട് തന്നെ നമ്മൾ തന്നെ എപ്പോഴും സംസാരിച്ചുകൊണ്ടിരിക്കരുത്. Okay, you need to make sure that you give a chance for the other person to interact with you, ask you questions. And many people think interaction എന്ന് പറയുന്നത് നമ്മൾ ചോദിക്കുന്ന ചോദ്യങ്ങൾക്ക് മറുപടി തരുന്നത് മാത്രമാണ് interaction. It is not. Okay, you ask questions to gather information. The patient gives the information. That is just question answering. That is not an interaction. An interaction will be when the patient is asking questions or queries about his treatment or his lifestyle modifications or things that he has to do. So അങ്ങനെ അവർ റിക്കവറിനെ പറ്റിയിട്ടൊക്കെ ചോദ്യങ്ങൾ നമ്മളോട് റേസ് ചെയ്യുക. ഇതൊക്കെയാണ് interaction വരുന്നത്. So when they interact, when they ask questions, you can give a response to that as an acknowledgement statement and then explain what their query. So അങ്ങനെ വരുമ്പോൾ ഒരു interaction വരും. Okay, so throughout your role play, if you have 5 tasks, you need to know, okay, or you need to plan, okay, 2 ടാസ്ക് കഴിയുമ്പോൾ I will ask this question. അല്ലെങ്കിൽ ഈ ടാസ്കിൻ്റെ ഇടയ്ക്ക് I will interact with the patient. അങ്ങനെ വരുന്ന ഒരു സ്ഥലത്താകുമ്പോഴേക്കും you can just put a question mark. Okay, ഇപ്പോൾ 3 and 4 തേർഡ് ടാസ്ക് കഴിഞ്ഞ് 4th ടാസ്കിലേക്ക് പോകുമ്പോഴാണ് നമ്മൾ അവിടെ ഇൻറ്ററാക്ട് ചെയ്യാനായിട്ട് പ്ലാൻ ചെയ്യുന്നതെങ്കിൽ just put a question mark. Okay, 3 and 4, just put a question mark in the middle, so you will know. You're guiding yourself, okay, now I need to ask the question. So ഇതുപോലെ ഗൈഡൻസ് ക്രിയേറ്റ് ചെയ്ത് വെച്ചാൽ നമുക്ക് 3 minutesൽ നല്ലോണം നമുക്കിത് എഫക്റ്റീവ്ലി പ്രിപ്പയർ ചെയ്യാൻ പറ്റും, and it will be easier for you. Okay, so plan your transition and then plan to interact. Okay, that's the 9th point. The 10th point, make notes as many as possible. Okay, create your own short forms, contradictions, and make sure that you try to write down a lot of information as possible, so that while you are doing the role play, you will not get stuck or you will not go out of topic, and you will know what you're talking and what you have to convey the patient as well. So എന്താണ് നമ്മൾ സംസാരിക്കേണ്ടത്, അല്ലെങ്കിൽ എങ്ങനെയാണ് സംസാരിക്കേണ്ടത്, എവിടെയാണ് ചോദ്യം ചോദിക്കേണ്ടത്, എപ്പോഴാണ് ഇൻട്രാക്ട് ചെയ്യേണ്ടത്, എപ്പോഴാണ് അക്നോളജ്മെൻറ്റ് കൊടുക്കേണ്ടത്, എപ്പോഴാണ് റീഅഷ്യൂർ ചെയ്യേണ്ടത്, ഇതെല്ലാം നമ്മൾ നേരത്തെ പ്രീ പ്ലാൻഡ് ആണെന്നുണ്ടെങ്കിൽ ഇറ്റ് ഈസ് ഗോയിങ് ടു ബി വെരി വെരി സ്മൂത്ത്. And you can do it very quick. ഇപ്പോൾ എല്ലാം കൂടെ കേൾക്കുമ്പോൾ you will be thinking like 3 minutesൽ ഇത്രയും ചെയ്യാമോ? This might be a very prominent question in your minds, and my answer is yes, because I tried it, okay, and I made few people to do it as well, and they could also do it, but initially it was difficult, but gradually it became easier for them to formulate everything. So സംസാരിക്കുന്നതിനെ പറ്റിയിട്ട് ക്ലിയർ ഒരു ധാരണയിൽ റോൾ പ്ലേ ചെയ്യുമ്പോൾ they are able to talk. Okay, because while doing the role play, their brain is relaxed, their mind is calm, and they do not have to think of what they need to talk next while they are talking. സംസാരിച്ചുകൊണ്ടിരിക്കുമ്പോൾ തന്നെ അല്ലെങ്കിൽ ഒരു ടാസ്ക് ചെയ്യുമ്പോൾ തന്നെ അടുത്തത് എന്ത് പറയണം എന്ന് ചിന്തിച്ച് അവർക്ക് പോകണ്ട, because they have already formulated it, and that formulation will definitely help you, because you have a clear idea. Okay, we know the direction, we know our destination, how we are going. From the introduction എങ്ങനെയാണ് ചെയ്യേണ്ടത്, അതിനുശേഷം നമുക്ക് ഇനീഷ്യൽ അഷുറൻസ് എന്ത് കൊടുക്കണം, ആൻഡ് ഫ്രം ദെയർ ഹൗ ടു ഓപ്പൺ ദ ടാസ്ക് നമ്പർ 1, അതിലേത് പോയിന്റാണ് എലാബറേറ്റ് ചെയ്യേണ്ടത്, ഹൗ ടു ഫിനിഷ് ടാസ്ക് നമ്പർ 1 ആൻഡ് മൂവ് ടു ദ ടാസ്ക് നമ്പർ 2. സോ ഇത് എല്ലാം നമ്മൾ പ്രീ പ്ലാൻഡ് ആവുമ്പോൾ ഇറ്റ് ഈസ് ഗോയിങ് ടു ബി ഈസി ഫോർ യു. ആൻഡ് ഈ ഇത്രയും കാര്യങ്ങൾ നമുക്ക് 3 മിനിറ്റ്സിൽ ചെയ്യാനായിട്ട് you can practice it. Okay, so everyone will have different way of preparation, and everyone might not be very it might not be flexible for everyone as well. Okay, because a person A ചെയ്യുന്നത് പോലെ person B ക്ക് ചെയ്യാൻ പറ്റണമെന്നില്ല. Each one has their own ability to do it. So anyhow, nevertheless, I would like to share a tip or a strategy that you can use while you are preparing. നിങ്ങൾ ഇപ്പം പ്രിപ്പയർ ചെയ്യുന്ന സമയത്തൊക്കെ ആണെങ്കിലും while you are doing the role plays with your friends or അങ്ങനെയൊക്കെ ആണെങ്കിൽ just first thing is that you set a timer for 1.5 minutes. Okay, set your timer for 1.5 minutes and try to read the entire case note. Okay, then understand the setting, the background information, the requirement of the patient, and the entire task, and frame your introduction and your initial assurance. ഇത്രയും കാര്യങ്ങൾ 1.5 മിനിറ്റിൽ ചെയ്യാനായിട്ടുള്ള ഒരു പ്രിപ്പറേഷനിൽ പ്രാക്ടീസ് കൊണ്ടുവരാൻ നോക്കാം. Set the timer for 1.5 minutes and try to do whether you are able to do all these things. Okay, if you couldn't 1.5 minutes ചെയ്യാൻ പറ്റിയില്ലെങ്കിൽ that's okay, no problem. First time you might not be, second time also you might not be, but gradually you will be, because you're training yourself to challenge yourself and you can do it. After you finish the first 1.5 minutes, set the timer for another 1.5 minutes. Okay, because you have 3 minutes, right? The next 1.5 minutes സെറ്റ് ചെയ്യുക, എന്നിട്ട് കം ടു യുവർ ടാസ്ക്. ഓരോ ആക്ഷൻ വേർഡ് പോവുക, ആക്ഷൻ വേർഡ് ടേക്ക് എ പേപ്പർ ആൻഡ് എ പെൻസിൽ ആൻഡ് put number 1 to 3 and ഏറ്റവും ഷോർട്ടസ്റ്റ് ഫോമിൽ നിങ്ങൾക്ക് എങ്ങനെ മനസ്സിലാക്കാൻ പറ്റുന്ന ആ ഒരു രീതിയിൽ ഷോർട്ട് ഫോംസിൽ as many notes as possible. ഓരോ ടാസ്കിനും ടാസ്ക് നമ്പർ 1 how to start, put a slash, ഏതെങ്കിലും പോയിന്റ് എസ്പെഷ്യലി അവിടെ എക്സ്പ്ലെയിൻ ചെയ്യാനുണ്ടെങ്കിൽ അതിൻ്റെ ഒരു ചെറിയൊരു കീവേഡ് എന്തെങ്കിലും മെൻഷൻ ചെയ്യുക, put a slash and how to finish it. എങ്ങനെയാണ് ഇപ്പോൾ ക്വസ്റ്റ്യൻ ചോദിച്ചു പോവുകയാണെങ്കിൽ ജസ്റ്റ് പുട്ട് എ ക്വസ്റ്റ്യൻ മാർക്ക്. ഓക്കെ, അതല്ല ഇപ്പോൾ കണക്ടർ ഉപയോഗിച്ച് പോവുകയാണെങ്കിൽ ജസ്റ്റ് പുട്ട് എ കണക്ടർ സൈൻ. അങ്ങനെ എന്തെങ്കിലുമൊക്കെ ഒരു സിംബലോ അല്ലെങ്കിൽ ടേംസോ കാര്യങ്ങളൊക്കെ നിങ്ങൾ തന്നെ ഫൈൻഡ് ഔട്ട് ചെയ്യുകയാണെങ്കിൽ ഇറ്റ് ഈസ് ഗോയിങ് ടു ബി മച്ച് മോർ ഈസിയർ ഫോർ യു. സോ ഇപ്പോൾ ആ ഒരു വർക്ക് ഷീറ്റ് കാണുമ്പോൾ തന്നെ ഇറ്റ് ഈസ് ഗോയിങ് ടു ബി ഇറ്റ് വിൽ ഗൈഡ് യു ത്രൂ ഔട്ട് ദ കോൺവെർസേഷൻ. സോ വൈൽ യു ആർ ടോക്കിംഗ് നമുക്ക് ആ ഒരു പേപ്പർ നോക്കാം. ഓക്കെ, നൗ ഇറ്റ്സ് മൈ ചാൻസ്, മൈ ടേൺ ടു ഇൻട്രാക്ട് വിത്ത് ദ പേഷ്യൻറ്റ്. ദെൻ യു വിൽ സേ ദ ക്വസ്റ്റ്യൻ മാർക്ക് there, you will ask, okay, is there anything else? So that your entire conversation is going to be smooth and it is going to be very easy for you as well. Okay, so these are the things that you have to do. അപ്പം നമുക്ക് 3 മിനിറ്റ്സിനെ 2 സെഗ്മെൻ്റ് ആയിട്ട് ഡിവൈഡ് ചെയ്ത് 1.5 and 1.5 minutes. The first 1.5 minutes, read through the entire thing, frame your introduction and your initial assurance. The next 1.5 minutes, go through your task, understand how you can enter each task, ഓരോ ടാസ്കിൻ്റെ ആക്ഷൻ വേർഡ് വെച്ചിട്ട് എങ്ങനെ you can enter each task, and then how you can finish also, and in between you can also go for the keywords. ഓക്കെ, കീവേഡ്സ് കൂടെ ഏത് പോയിൻ്റാണ്, ഏതൊക്കെ ചോദ്യങ്ങൾ ചോദിക്കണം, ആ കാര്യങ്ങളൊക്കെ നമുക്ക് ചെയ്യാം. ആൻഡ് ഓൾസോ യു ക്യാൻ ഡിസൈഡ് ഓൺ വെൻ ടു ഇൻട്രാക്ട്, ഏത് പോർഷനിൽ എത്ര ടാസ്ക് കഴിയുമ്പോഴാണ് ഞാൻ പേഷ്യൻ്റ് ഇൻട്രാക്ഷൻ കൊണ്ടുവരേണ്ടത്, ഇങ്ങനത്തെ എല്ലാ പോയിൻറ്റ്സും you can come up with. Okay, so then it will be more easy. Okay, so try to do like this and try to prepare like this. Again, I'm telling you, the first time you try to do this, it is not going to be that easy. And don't curse me if it is not easy for the first time. It will take some time. Trust me, it will, okay? But if you do it, it is going to be it is going to be different and improvised, because you know how you did your first role play, right? The number 1 role play, ആദ്യത്തെ റോൾ പ്ലേ നിങ്ങൾ ചെയ്തതും ഇപ്പോൾ നിങ്ങൾ റോൾ പ്ലേ ചെയ്യുന്നതും തമ്മിൽ ഒത്തിരി വ്യത്യാസമുണ്ട്. ലൈക്ക് വൈസ് നിങ്ങൾ ആദ്യമായിട്ട് എഴുതിയൊരു ലെറ്ററും നിങ്ങളിപ്പോൾ എഴുതുന്ന ലെറ്ററും തമ്മിൽ നല്ല വ്യത്യാസമുണ്ട്. there will be far difference, right? So you know you can improve. നിങ്ങൾ ആദ്യം ചെയ്ത പോലെ തന്നെ ആയിരിക്കില്ലല്ലോ ഇപ്പോഴും ചെയ്യുന്നത്. there will be slight improvements. Likewise, ആദ്യം നിങ്ങളിത് പ്രിപ്പയർ ചെയ്യുന്ന ഒരു സമയത്ത് ഇതുപോലെ ടൈമറൊക്കെ സെറ്റ് ചെയ്ത് ഞാൻ ഈ പറഞ്ഞ സ്ട്രാറ്റജിയിൽ ചെയ്ത് നോക്കുവാണെങ്കിൽ തുടക്കത്തിൽ ചിലപ്പം ഇത്തിരി ബുദ്ധിമുട്ടുണ്ടാകും, അല്ലെങ്കിൽ എല്ലാം ഫിനിഷ് ചെയ്യാൻ പറ്റുമെന്നൊക്കെ വരത്തില്ല. ബട്ട് സ്റ്റിൽ ഗ്രാജുവലി യു ക്യാൻ ചാലഞ്ച് യുവർ സെൽഫ്. ഓക്കെ, സേ ഫോർ എക്സാമ്പിൾ നമ്മൾ സെക്കൻഡ് 1.5 മിനിറ്റ്സിലാണ് നമ്മൾ നോട്ട്സ് പ്രിപ്പയർ ചെയ്യുന്നത്. സോ അപ്പോൾ ആ നോട്ട്സ് പ്രിപ്പയർ ചെയ്യുന്ന സമയത്ത് എല്ലാ ടാസ്കും കവർ ചെയ്യാൻ പറ്റണമെന്ന് നിർബന്ധമില്ല. ബിക്കോസ് യു ആർ മേക്കിംഗ് ഡീറ്റെയിൽഡ് നോട്ട്സ് ഫോർ ഈച്ച് ആൻഡ് എവറി ടാസ്ക്. അപ്പോൾ അത്രയ്ക്ക് ഈസി ആവണം എന്നില്ല. ഡോണ്ട് വറി, ഡോണ്ട് ഗീവ് അപ്പ്. ബട്ട് ജസ്റ്റ് ഇമാജിൻ നമ്മൾ ഒരു റോൾ പ്ലേയിൽ ഒന്നും ഇല്ലാതിരിക്കുന്നേക്കാളും നല്ലതാണ് നല്ലോണം ചെയ്യാൻ പറ്റുന്ന ഒരു 3 ടാസ്ക് എങ്കിലും. ഓക്കെ, തുടക്കം തൊട്ട് അവസാനം വരെ ഒരു നോട്ട്സും ഇല്ല, ഒന്നുമില്ല, ജസ്റ്റ് യു ആർ ബ്രെയിൻ സ്റ്റോമിങ് സം ഐഡിയാസ് അറ്റ് ദ മൊമെൻറ്റ് യു ആർ ടോക്കിംഗ്. അങ്ങനെ വരുമ്പോഴേക്കും ദ കോൺവെർസേഷൻ എൻറ്റയർലി വിൽ ബി എ മെസ്. ഓക്കെ, സോ അപ്പോൾ അവിടെയും ഇവിടെയും ഒന്നുമില്ലാത്തതിനേക്കാളും നല്ലതാണ് നല്ല പെർഫെക്റ്റ്ലി ചെയ്യുന്ന ഒരു 3 ടാസ്ക് എങ്കിലും. ഓക്കെ, സോ ഇഫ് യു കനോട്ട് ഫിനിഷ് all the tasks and if you could only complete 1 or 2 tasks, no problem. The next day challenge yourself, I will complete 3 tasks. So gradually improve yourself. Okay, you guys can definitely do it. You have come so far, right? So don't give up and try to implement this and let me know whether it was helpful for you guys. Okay, so we have completed the things that you need to do during the 3 minutes time. Now I'm going to share a cue card. I will display it on my screen right now and we will discuss the cue card and ഇത്രയും പോയിന്റ്സ് നമുക്ക് എങ്ങനെയൊക്കെ ചെയ്യാം. ഓക്കെ, സ്റ്റാർട്ടിങ് ഫ്രം ദ സെറ്റിംഗ്, ഓരോ ടാസ്ക് ട്രാൻസിഷനും എവിടെ ഇൻട്രാക്ട് ചെയ്യണം എന്നുള്ളത് വി ക്യാൻ ഡിസ്കസ്. ഓക്കെ, സോ ഐ വിൽ ജസ്റ്റ് പോപ്പ് ദി കേസ് നോട്ട്. Do let me know if it is visible for you guys. If yes, please let me know. So this was one of the exam question models. Okay, we had ear piercing is a very common topic that has been asked for exam once, I guess. So we will discuss this particular case note. Okay, I'll just give you a few minutes to go through that. Okay, just have a quick read through it, just 1 quick minute. Okay, just go through that. Alright, so I hope you guys had a quick read through it. Don't worry, we will just discuss it together. Okay, so you guys can see that we have the setting given here. The setting is community health center. Again, normally we take community health centers as unknown cases. Okay, but do not jump into a conclusion. As I mentioned, you have to go through the background information to get to that. Okay, so let's look into the background information. You see a 20-year-old who has a recent ear piercing that has become quite sore. You have examined the area around the piercing and can see there is a granuloma, a small lump next to the piercing, which combined with the patient's symptoms indicates an infection. Okay, see, it only took me few minutes to read this, sorry, few seconds to read this. Okay, and from this I got the required information as well. I came to know that I'm talking to a 20-year-old one and the patient had an ear piercing and now it is sore, and it's also mentioned you have just examined. That means it is a non-case because the examination was already done. So this is how you try to understand whether you're talking to a non-case or an unknown case, irrespective of what the setting is. Okay, so we already know that examination is done. And what did you find during the examination? You found that there is a small lump okay, and which is next to the piercing, and combined with the patient's symptoms, it indicates an infection. So you know that it might be an infection too. Okay, so from this we can frame our introduction. Since it is a noun case, like you have already examined the patient, you need to know the patient's name when you start the role play, and you can start the role play by just thanking the patient for the for the examination, the cooperation for the examination. You do not have to greet the patient, or you do not have to introduce yourself here, because you just finished the examination. That means this role play conversation is taking place after the examination by explaining the findings that you had during the examination. Okay, so here you can frame an introduction like, "Thank you, Miss Maria, for your cooperation." Okay, "Thank you, Miss Maria, for your cooperation. I have just finished my examination." And then you can pick some information from the background information which is given there. "On my examination, I found that there is a small lump next to the piercing which is sore." So you're just confirming the diagnosis that you got. Okay, so that is what you're doing. So don't worry. Then you can provide an initial assurance as well. You're just saying that, okay, this is my finding, and clubbing to that, you can give an initial assurance. Okay, you can say that, or you can ask a question like, "So I can see a lump next to the piercing. So how are you feeling now?" If you want, you can ask a question like that. So Miss Maria will say, "Oh, I'm not feeling good. It is really painful." You know, she might say something like that. So you can provide an initial assurance there. "Oh, I'm so sorry to hear that, but don't worry, you have reached the right place. We will do the needful." Okay, so you have decided so much here, right from the introduction, like the opening statement till this part. So you're pretty clear till that. So now next thing what you have to do is you have to go through each task one by one. So you guys have already read it, so I'm taking you through each task one by one because we don't have much time, So the first task, find out details of ear problem, onset, level of pain, previous occurrences, etc. Okay, so here our action word is find out. Okay, we have to find out something, and what is that something? We need to find out the details of the ear problem. And what are the details? We need to find out when it started and what sort of pain she's experiencing, whether she had any previous occurrences. Okay, so these are the three things that you need to find out. So once you see this task, you know that this is an information gathering one, right? You're collecting information. So whenever you collect information, you need to signpost. So now if we look onto the conversation thing, the first thing, you thanked Miss Maria for the cooperation, and then you asked her, "How are you feeling?" So she said, "Oh, I'm not feeling that good." So you provide initial assurance. That is the second thing you did. You said, "I'm sorry to hear that, but don't worry, you have reached the right place. We will do the needful." So the conversation is there. Okay, from there you need to move to your task number one, right? So you know the task number one is information gathering, so you need a signposting statement. So from that part, don't worry, you have reached the right place, we will do the needful. From there you can use a signposting statement like, "But in order to help you, I need to ask you some questions if you don't mind." Use the signposting statement there, okay? "But in order to help you, I need to ask you some questions." All right? And if you want, you can say that as some questions about your ear problem. If you want, you can add that, okay? Then she is saying, yeah, fine, you can ask me. So you're asking each question one by one. The first thing is onset. So you're asking, when did it start? All right, so she's saying, yeah, it started like the day after the piercing. Okay, so you can say, I'll make a note of that. Interact. Okay, you asked a question, patient said an answer, interact with the patient there. Oh, I'll make a note of that. Okay, second question. If I give you a pain scale, okay, where 0 is no pain and 10 is the worst pain, how much would you rate it? So she's saying, yeah, I would rate it somewhere around 8-ish. So you're saying, oh, that must be difficult, because she said she's having severe pain. So you can say, oh, that must be difficult. Then you can ask next question. You can say, I would like to ask you one more question, Miss Maria. Is this the first time you're experiencing this, or do you have any previous occurrence of this? So she's saying, no, this is my first time. Okay, so you have finished task number one. Now you need to know how you will be moving from task number one to task number two. അതെങ്ങനെ ചെയ്യണമെന്ന് അറിയണമെങ്കിൽ യു നീഡ് ടു നോ വാട്ട് ഈസ് ദ ആക്ഷൻ ഫോർ ദ നെക്സ്റ്റ് വൺ. ആ അടുത്ത ടാസ്കിലെ ആക്ഷൻ വേർഡാണ് നമ്മുടെ ഒരു കണക്ഷൻ മീറ്റ് ചെയ്യുന്നത്. സോ അടുത്ത ടാസ്ക് നോക്കുകയാണെങ്കിൽ ദ ആക്ഷൻ വേർഡ് ഈസ് കൺഫേം, റൈറ്റ്? So you are confirming to the patient. So you are telling the patient our confirmation, അതായത് നമ്മൾ presence of granuloma ഉണ്ടെന്ന് നമ്മളൊരു കൺഫർമേഷൻ കൊടുക്കുവാണ്. സോ അപ്പോൾ ആ ഒരു കൺഫർമേഷൻ കൊടുക്കുന്നതിന് മുന്നേ തന്നെ ഇവർ ഇത്രയും ക്വസ്റ്റ്യൻസിന് ആൻസർ തന്നത് കൊണ്ട് വി ആർ ഗിവിങ് എ താങ്ക് യു there. Okay, you can say thank you so much for giving me the answers or something like that. Alright, then you can come to the next task. നമ്മൾ ഓൾറെഡി തുടക്കത്തിൽ പറഞ്ഞിരുന്നു എക്സാമിനേഷനിൽ ഇങ്ങനെ കണ്ടു എന്ന് പറയുന്നുണ്ട്, നമുക്കത് ജസ്റ്റ് നമ്മൾ കൺഫേം ചെയ്യാം. സോ ദാറ്റ് ഈസ് എ നെക്സ്റ്റ് ടാസ്ക്. ഓക്കെ, കൺഫേം പ്രസൻസ് ഓഫ് granuloma, small fluid filled lump. Okay, and you're explaining what it is. Formed of cells to fight infection, no cause for concern, stress importance of not removing earring, hole closures, traps, infections, etc. Okay, so we just need to confirm the presence of it. അപ്പോൾ നമ്മൾ ഓൾറെഡി അത് പറഞ്ഞിട്ടുള്ളത് കൊണ്ട് നമ്മൾ ഈ ക്വസ്റ്റ്യൻസ് ഒക്കെ ചോദിച്ചു, ആ ഫസ്റ്റ് ടാസ്കിൽ ക്വസ്റ്റ്യൻസ് ഒക്കെ ചോദിച്ചു കഴിഞ്ഞു. ആൻഡ് വി സെഡ് എ താങ്ക് യു. ഓക്കെ, താങ്ക് യു ഫോർ യുവർ കോപ്പറേഷൻ. ആൻഡ് ഫ്രം ദെയർ വി ആർ മൂവിങ് ടു ദ ടാസ്ക് നമ്പർ 2. യു ആർ സെയിങ്, വെൽ മിസ് മറിയ, ആസ് ഐ ഓൾറെഡി ടോൾഡ് യു, ബിക്കോസ് ഓൾറെഡി നമ്മൾ പറഞ്ഞിട്ടുള്ളത് കൊണ്ട് യു ക്യാൻ സേ ആസ് ഐ ഓൾറെഡി ടോൾഡ് യു, on my examination I could see that you are having a small lump on next to the ear piercing, and it is called a granuloma. And you can ask a question. Okay, do you know what is granuloma? Then she will say, no, I don't know what it is. It's something that I need to be worried about. So you're saying, don't worry, I'll explain that to you. Okay, then you're coming to the explanation. Okay, so the explanation goes like this. Granuloma is a small fluid-filled lump which is formed of cells in order to fight infection, and there is nothing for you to be concerned about. However, I would like to stress the importance of not removing the earring. The reason being because it will close the hole, trapping infection, and it might cause further complications. Is that clear for you? It is a well-constructed sentence. I'll go again one more time. You're saying, I'll explain that to you. Granuloma is a small fluid-filled lump which is formed of cells in order to fight infection, and there is nothing you need to be worried about. However, I would like to also tell you the importance of not removing the earring because it closes the hole and traps infection, causing many complications. Is that clear for you? See, it's well constructed and to cover that particular task. So now the conversation ends like, is that clear for you? So she is asking you a question back. Okay, ഇനി അവരുടെ റെസ്പോൺസ് എങ്ങനെ ആയിരിക്കും നമുക്ക് മുൻകൂട്ടി അറിയാൻ പറ്റും. How? By looking on to the next task. When you look on to the next task, you can see, give reasons for your clinical opinion. What do you mean by that? നമ്മൾ പറഞ്ഞ ആൻസറിൽ അവരത്ര ഹാപ്പി അല്ല. അപ്പോൾ അവരൊന്ന് കൺവിൻസ് ചെയ്യിപ്പിക്കാൻ നമ്മൾ നമ്മുടെ ക്ലിനിക്കൽ ഒപ്പീനിയൻ പറഞ്ഞതിന് എന്തുകൊണ്ട് നമ്മളത് പറഞ്ഞു എന്നുള്ള റീസൺസ് കൊടുക്കണം. ഓക്കെ, ഗീവ് റീസൺസ്. റൈറ്റ്, സോ ഇറ്റ് ഈസ് എ കണ്ടിന്യൂഷൻ. വെൻ യു ആസ്ക് ഇസ് ദാറ്റ് ഓക്കെ ഫോർ യു, ഷീ വിൽ നോട്ട് റിയാക്ട് ഇൻ എ ഗുഡ് വേ. ഷീ ഈസ് സെയിങ്, ആർ യു ഷ്യൂർ ഇറ്റ് ഈസ് നത്തിങ് ടു ബി വറീഡ് അബൌട്ട്? ഷീ ആസ്ക്ഡ് എ ക്വസ്റ്റ്യൻ ടു യു. So to give an answer to that, you're moving to the next task. You're giving reasons. You can say, that's a reasonable reaction. You can decide, okay, now the patient is not happy with my answer, so I need to console the patient. So I'll use an empathy statement. That's a reasonable reaction. Don't worry, I will give you the reasons for my clinical observation. Okay, and you can explain the way the lump looks and feels. I can say that it is linked to an infection and there are no other symptoms. It is quite common after ear piercing, so there is nothing for you to be worried about. A simple statement. Okay, the way the lump looks and feels, it is linked to an infection and there are no other symptoms, so there is nothing for you to be worried about. Okay, so the patient is telling you, okay, fine, yeah, that's fine. So the conversation got end there. Now if you look on to the next task, warn against over-the-counter antibiotic ointments. Alright, so you're warning the patient. So your action word is warn. So when you have to warn about over-the-counter antibiotic ointments, that means ആ ഒരു OTCയുടെ ഡിസ്കഷൻ അവിടെ വന്നിട്ടേ ഇല്ല. So ആ ഒരു ഡിസ്കഷൻ അവിടെ വരണമെങ്കിൽ you have to ask the question to the patient. Okay, so we need to know whether the patient used any OTC ointments. Okay, so you can ask the patient. So let me ask you a question. After the end of third task, you can ask. So Miss Maria, I would like to ask you one question. Did you use any over-the-counter ointments? Okay, so she is saying, yeah, I tried something at home. Okay, so you're warning the patient against it. You can say something like, Miss Maria, I understand that you would have been really nervous, but I would like to tell you that please do not use any over-the-counter antibiotic ointments. Please do not. Warn against means you are telling a no. So in order to say a no, that is something negative, right? You're stopping a person. So you need to say in a very polite manner. You can say, please don't use any over-the-counter antibiotic ointments without prescription. Instead, you can wash the infected area at least 2 to 3 times daily with warm, salty water. Make sure you avoid perfumed toiletries. If you are experiencing severe pain, you can press water-soaked cotton pad against the lump and you will feel better. Okay, I'll go again. So you can say, Miss Maria, I understand you were really worried and that's the reason why you used an over-the-counter ointment. However, I would suggest you not to use any over-the-counter antibiotic ointments without a proper prescription. Instead, you can wash the infected area at least 2 to 3 times daily with warm, salty water and avoid perfumed toiletries. In case if you have severe pain, try pressing a water-soaked cotton pad against the lump and you will feel better. You finished it too. Then there is a sub-portion, find out any other patient concern. So again, you're finding out, okay? So we can say, well, that being said, do you have anything else to ask me? Okay, so that being said, that means we discussed so far. So that being said, is there anything else you would like to ask me? Okay, so the patient will ask you any question if the patient has. So moving on to the next task, you're advising the patient when to see the doctor. No improvement in symptoms, spread of infection, development of other symptoms, high temperature, increased pain, swelling, redness, pus, etc. So we know that on the previous task, when you asked is, do you have any other concerns, the patient might ask you, so what should I do if my symptoms are not, improving, or should I see the doctor or something like that? Okay. So as an answer to that, you can say, well, that's a reasonable reaction from your side. I would suggest you to see the doctor if you're not seeing any improvement in the symptoms, and also if you notice any spread of infection or if you develop any other symptoms, make sure that you see the doctor. If any other symptoms such as high temperature or increased pain or swelling, redness or pus formation, please do not waste your time. Come to the hospital. Okay, then you're finishing it. Okay, so you have come to the second last task. Once you reach here, you can always ask the patient. It is better to do that, okay, because you will get some time to relax and some time to think also. You can ask a question like, so Miss Maria, we have discussed a lot of points and I hope everything is clear for you. Do you have anything else to ask me, or is there anything else you want me to do for you? Okay, so she is asking, yeah, but could you please tell me how I got this infection? So if you look at the last task, give possible reasons for infection. You're explaining why the infection was caused, right? So you're giving possible reasons. So as an answer to that, you can say, definitely, Miss Maria, I'll take you through the various reasons of an infection after ear piercing. It is quite common. There are various reasons for it as well. One being usage of unhygienic equipment to pierce the ear, or it might even be an allergic reaction. Okay, maybe due to the metal. Okay, the metal that being used. Or in case if you have a sensitive skin, that can also cause this infection. Then don't stop there, because you're talking about the causes of infection. So to add on to some info, to make the patient feel better, you can say something like, but as I mentioned earlier, don't worry, it will go off very soon. In case if you notice severe complications, please come to the hospital. And you can wind up the conversation. Now coming to the conclusion part, how you can have a good conclusion here. You can say something like, I hope that I have cleared everything for you, so there is nothing for you to be worried about. you will be, your infection will go off very soon. In case if you would like to discuss anything further, please feel free to do that. And then you can finish the conversation, okay? So this is how this particular conversation will go on, okay? So I have just showed you how you can plan it by looking into the action words and deciding about how you can start, okay? ഓരോ ടാസ്കിൽ നമ്മൾ ടാസ്ക് 1 ചെയ്ത് കഴിയുമ്പോൾ അടുത്ത ടാസ്കിലേക്ക് പോകുമ്പോൾ അതായത് നെക്സ്റ്റ് ടാസ്ക് നമ്പർ 2ൻ്റെ ആക്ഷൻ വേർഡ് വെച്ച് നമുക്ക് കണക്ട് ചെയ്യാം, ഓക്കെ? അതായത് ടാസ്ക് 1ൻ്റെ ഫിനിഷും ടാസ്ക് 2ൻ്റെ സ്റ്റാർട്ടും തമ്മിൽ ഒരു കണക്ഷൻ ഉണ്ട്. യു ഹാവ് ടു ഓൾവേസ് connect to the previous conversation to maintain the flow of your conversation, okay? So these are few things that you can do during your 3 minutes preparation time, and I hope this was helpful for you guys as well. So I would also like to repeat one point. Initially, when you try this 1.5 minute strategy, it might be a little difficult, but still try practicing it, and it might be very easy for you guys to make some notes. So again, one point that I would like to tell you is that role play il nammal prepare cheyyade ഒന്നും ഇല്ലാതെ പറയുന്നതിനേക്കാളും ഇതുപോലെ prepare ചെയ്ത് വെച്ചിട്ട് എന്തെങ്കിലുമൊക്കെ പറയുന്നതാണ് always better, okay? So try to do that. So I hope that's all for today. If you guys have any questions, you guys can let me know, and I hope it's almost time up. So I'll see you guys next time, okay? And it's coming, the holiday seasons are coming, so advance Merry Christmas from my side and from IILT's side. So enjoy your holiday seasons. At the same time, make sure that you do not bring a pause for your training as well, okay? So I hope this session would have been helpful for you guys. If yes, let us know in our comment sections, and also we are also open for your suggestions and recommendations. Let me know. I'll go through all the comments and get back next time. Until then, take care. Bye bye.